Hello, my name is Holly Dinnany, and I'm with Family Partners of Morris and Sussex County in New Jersey. And it is my pleasure to welcome you to our weekly educational event we call Lunch and Learn. And the purpose of Lunch and Learn is to help us introduce to you experts in the field of caring for youth with special needs and challenges. And our weekly program has been very successful through COVID, helping us bring to you experts in different fields from different organizations who come to talk to us about things that we really need to know about and resources that we need to be aware that are available to us. So I am going to tell you that we are recording today's session, which will be available following the presentation. We will send it to you if you're on this call. We will also post it on our on our YouTube channel. And I am telling you right now that our guest today, Adrienne Robertiello, is a special healthcare educator with Children's Specialized Hospital, and she has an action-packed presentation lined up for us. So if you have questions throughout the presentation, drop them in the chat and we'll be sure that we get to them. But there's a lot of material that that she'll be sharing with us, but fear not, we are sharing the slides afterwards and also a very extensive resource list that has embedded links that will help you find all these materials. So I could say so many wonderful things about Adrienne. She's been with us before. She spoke to our mom squad about how we improve and help healthy dynamics with siblings when there's a special needs youth in the mix. So if you haven't already seen that, check it out. It's on our YouTube channel. And Adrienne, I could talk about you forever because I love the energy and the passion that you put in. You are a parent of a special needs individual. And I love that you are not only in it for your heart, but your smarts. You are putting your skills to a really good use to help those of us who care for challenged youth. So Adrienne, I'm turning it over to you. Take it away.
Thank you, Holly, and hi, everyone. So I am going to say I will be speaking very quickly. I'm going to go through a lot of these topics because there is so much to cover. But if there's anything, any question you have, or if there's anything that you would like me to expand upon, I would love to do that at the end. So that's why I'm going to go through this pretty quickly. So let's get going. Let's start. There we go. I do have to put in a plug. The work that I do all through pretty much most of the time that I've been at Children's Specialized is funded by a generous donation by Kohl's Care. So those stuffed animals and those books that you see in those stores, those are the things that really are funding a lot of the work that I do and other people do throughout this country. So I say kudos to Kohl's Cares and great job, Kohl's. Okay, so safety is important and sometimes not often part of our conversation. It's important for everyone and everywhere. So this is very often when we hear about planning for safety, we hear about planning for typical children or adults. We see all these resources all over the internet and we get this training all over the place, but it's not often for people with disabilities. So I want to just briefly share that we're working on a grant right now that we have received, that we have through, it's called the Inclusive Healthy Communities Grant from the New Jersey Division of Disability Services, New Jersey Department of Human Services. And you can see right there some of the categories that we're working on, and it's totally focused on individuals with disabilities and special health needs. So we're focused on that in so many areas. If anybody would like to know more about this grant and the work we're doing, I would be happy to share that. After this presentation, you can give me a call, send me an email, would love to share more. So now let's talk about safety. So let's start with home safety. So we look at some of these things that are in our homes. So it could be people, our children, they may fall. There are household hazards, and you can look at some of these pictures I used. When we think about typical kids, we're from birth to, let's just say, kindergarten and in first grade, we are involved very much in their safety. And even for kids with special needs, we can be involved in their safety. But then these kids get older, and those things that we buy in the stores, those little locks that we put on the cabinets, kind of doesn't work the same way that they would for a young toddler, right? And we have lots of these things that you see here on the screen that could be challenging for many of our kids and even adolescents and adults with disabilities and special health needs. Some of them are maybe, throwing or breaking things, climbing on things. They may not know how things work. They may not know cold from hot, or even be able to feel cold from and hot. We can see that those little detergent pods here, which they're now coming in really great protective packaging, but we're now talking about potentially older kids, adolescents, who this kind of looks like candy, and these things are really potentially very dangerous when ingested. So let's look at those safety challenges and make sure we pay attention and are preparing for them. As I mentioned just a moment ago with those pods, those detergent pods, it could be anything. Pipe gut is when we ingest something that's not meant to be edible. So that could be, as you see here, cat litter, a coin, small toys. It could be for sensory purposes where they like that feeling, or it could be a behavioral challenge that they're having. But these are things that we need to look at, and potentially if they're something that could be dangerous. So in New Jersey here, we have something we call NJ PIES, and that's that number. I recommend everybody keep that number available. Great organization. It's not 911. So if your child ate the dirt or the cat food or something else, you give them a call and they walk through that with you and help you through what to do next. If 911 needs to be called, they will absolutely assist you with that. If you think it is a life-threatening emergency, don't call this number, call 911 immediately. But this is 24 hours a day, 7 days a week. You can call the Poison Help number, and they are a great way to for anybody who's eating something or has ingested something that they think might be problematic. So we talked about, when kids get older here, and we talk about some safety locks and latches, brackets, things that we put on in our homes and around our homes to protect against dangerous things. But again, it's often based on age. There's different challenges and strength and motor skills that are in process. So the tip here is to keep things at a sight, out of reach as much as possible, and to remove access until that person understands the safety aspect and has mastered that skill. And we always should, protect things as long as much as we can, but we also want to get to a point, if the person is able and understanding, that we want to empower independence and use of things, right? But we want to make sure safety is first, and we're protecting and making sure they understand safety risks. Some of the things, you'll see these little letters on the top of the slides. Those refer to the letters that are on that resource list that you'll be getting after the presentation. So A, B, C, they'll go along right with these pages on the slides. So you'll be able to correlate the information with those resources. So this is something we made. You can feel free to print them, cut them out, make your own, color them your own, and you can put these throughout your house on things that are out of limits. And so these are just some visual symbols that can be used on things that we would not want a person to access. There is an organization in New Jersey called Advancing Opportunities. They do a lot of things, but we're going to talk right now really quickly about safety. They can do assessments in the household, looking at accessing refrigerators, falling, poisons, all these things, elopement and wandering. They can help you do that assessment. And I gave that information there at the bottom of the page. They are a qualified provider through the Children's System of Care. So that means if you are part of the system, that DD Perform Care system, then this can be for you. So I just gave some information here, and they are very, very helpful and friendly organization. Okay, so that's home safety. Now let's talk about fire safety. So some of our kids, adolescents and adults, I'm going to go there throughout the lifespan, they may have various fire safety challenges. So they may not understand any type of fire danger, lighting something, or if something was burning, what that means, the barbecues or fire pits, all of those things they may not understand. They may not know how to communicate if they do get burned. Even they may not be able to feel it, depending on that child's sensory issues for that child. It may be difficult to predict the person's reaction. So we're talking a person maybe with autism or anxiety or other intellectual developmental disabilities may act unpredictable in a fire. It's a very, this is a crisis that's going on, and we all may act differently in these kinds of situations. So I'm just going to say sometimes people, I'm going to use autism for this example, they may have a place that they feel safe in your home, right? It may be in a closet, under a bed, in the basement. It could be someplace that they feel safe and secure, and they go, but that place may be at risk during that fire. So I'll talk about that in just a minute, but we really need to make sure we know where that safe place is for our child, because again, if there's a fire, we need to know and help them there. And they also may not understand or be able to generalize instructions or drills. So a fire drill that you do in your house and you're at grandma's, they may not be able to transfer it in that location, or if you learn it in school, they may not be able to transfer it home. So we want to teach these things in multiple places with multiple people. Really important to help generalize those instructions and the drills. So that safe place, as you can see, could be anywhere. We should identify where that is. When we talk about fire safety and if we have fire drills, hopefully you do, and we're developing, as I said, as part of the grant, some really great resources where we need to develop safety plans, right? And involve our children as best they can with those safety plans. I wouldn't call this my safe place. We really need to reword that. That could be the place they like to go, but we need to have that safe place, that safety zone out of the house at a place that everybody knows where it's going to be. So they know that if there is a fire, they can go to that place, not necessarily to this place here that they feel comfortable. Sesame Street for our young kids put together this really cute, great family guide, giving about making a map, ways to get out, getting out and staying out, ways. So I'm not going to go through this detail, but it's really a great, the link is there on the bottom, and the little D there is, you can click on it and be able to go right to this resource here. This is more things that they have on that website. And I know this because my son has watched this 1,000 times, I'm sure, but it's Elmo Visits the Firehouse. If you could find this online, I'm sure it's old. I'm not sure if you can still get it. I don't even know if they still have CDs or DVDs or whatever they are, but I could recite some of the songs. It's like, get out, stay out, don't you go back in, and really great stuff here. So if you have the opportunity for a young child, particularly if they love Elmo, really great video on Elmo Visits the Firehouse, and really puts this in perspective, and also gives the perspective of Elmo, who experienced a fire at Hooper's store, and really how it made him feel and how they helped him get over that. Really great video, I recommend it. All right, so now we'll talk about a little bit about emergency response and interactions with first responders. So I'm going to flip the slide from the child and you over to the emergency responders and some of the challenges that they might have. So your child may have communication difficulties. They may not listen, understand what the instructions are. They may not respond to a verbal command. So these are some of the challenges for the emergency responders. That person may not comply with the instructions or may resist them when they try to help them in the escape. So that's the struggle. There's a risk of eloping. So yes, they may rescue them out of the home, but then they may either elope and to some place, they may just go running. And so then we have another issue besides the fire, or they may go back into the home or another home per se. So these are some of the things, the safe place we talked about. And I'm going to emphasize the bottom one for a second. So many families who have kids or adolescents who have a tendency to elope and wander will do some really creative things on their windows and doors to kind of prevent that person from leaving the home, right? And so these are bars and windows on the windows, or wood, or these really creative. I heard of someone had a barn door of some sort installed. There can be special bolt locks on the door. But if the emergency responders do not know about this, this may prevent your child from coming out, but it will also prevent and restrict that rescue from happening in an efficient and quick way. And time is of the essence. So it's very important, whatever you do in your home, to have that communication with your local first responders so that they are aware. Really very critical. So ways you can have these connections with emergency responders, you see a lot of it here. Sometimes it's at school, sometimes, I mean, invite them over for, you know, I know it's weird with COVID right now, so you can do something virtual, but there's also, you know, have a barbecue and say, hey, you want to come over and meet my, you know, Philip, you know, come over. You can see a lot of these kinds of interactions. National Night Out just happened. That's a great way to do it. So any opportunity you have to connect with any of your local emergency responders, police, fire, rescue, please do. Please definitely do. This is a sheet that we've created. Again, it's a resource that you can fill out. It's not an official form in any way, but you can use this and share this with your local responders. For a very long time, I printed this and I kept it 2 places. I had it, I'm not sure if it meant anything, but I had it on my refrigerator. And I also had it clipped to the back seat of my the car. My car seat, it was clipped to the back. And so if I ever became incapacitated, somebody's going to have a little bit of information. This also could serve as a conversation when you talk to your emergency responders so they can know a little bit more about your child. So I remember I said you should tell about, you know, those things in your home, but you could also tell, you know, does your child have the tendency to wander? Will they not respond to a verbal command? All of these things that you feel might be challenging. And I'm not only talking about your child, this could be your elderly parent who may have certain needs, whatever it might be. Contact your local dispatch center. Do not call 911, but call every town is different, wherever they dispatch 911, contact them and talk to them. It could be virtually, it could be in person, and share information about your child that's critical to rescue. That could be police, fire, or rescue. Really important to have that conversation. So we have a resource that we developed here to help guide you through that conversation and some of the things that you might want to disclose to them. So this is really your cheat sheet for having that conversation with your emergency responders.
I don't want to interrupt your flow here, Adrienne, but I just want to remind folks that this is will be available afterwards. I mean, I went through some of these materials and they're very specific and very helpful. So the little letter in the corner means that's how you find it at the end, right?
Absolutely. Okay, so 911. So some people with various disabilities can understand what 911 is for, and that it's not something that you just call for you know, for any reason, and some individuals cannot conceptualize what that means, right? And so it can be taught in school, but you know, if I'm just going to give an example, if you eat peanut butter every day and today there's no peanut butter at school, that might be a crisis to a child, a real crisis, but that's not a 911 call, right? And so we have to be careful about how we teach and who we teach. And so this tool right here, this resource that's available online, absolutely talks about what an emergency is, provides a little script for the person. Say, my name is, and here it is, and I have autism. It could be any disability there. So giving that script, practicing this is really great. They tell you what you should do, who you're speaking with, that, you know, and what to do if that emergency would happen. You know, this is all great, and I think is important to teach, but you also have to remember that a person in that crisis all of us may act very different. And we're talking with kids maybe who have anxiety or other things. Let's practice this, let's reinforce it, but remember, it may not always turn out, you know, as expected, but we really should prepare and plan as much as possible. So this is kind of really quick what's that little script is like. And feel free, based on your own home or apartment, to adjust that any way that you would like. So I talked quickly about developing a safety plan. So through our grant, we are working on helping you in a very easy way create that safety plan. So either by drawing or taking pictures and helping hopefully with your child, but definitely preparing and practicing a safety plan for exiting the house. Important that there's not just one way out. There should be 2 ways out of every aspect. There's things that we're developing on fire alarms and recognizing them and what to do. So all of these things are part of the resources that we'll be providing, but definitely you can start here and working on a safety plan. And if it's not our resources, please feel free to Google them. And even, like I said, Sesame Street resource really had a great one as well. So I think I say this a couple times in this presentation, but if not, I'm going to say it really loud and clear here. please don't use a police officer as punishment. So don't say, if you do this one more time, I'm going to call the police. So we hear this and we see this, and believe me, I check it, and I know our police officers check it as well, because we really need to make sure that our police police force or our law enforcement and other emergency responders are considered safe, that when they need something, if they're lost, if they need something, they're going to go to them. So please, please, please do not use police officers as that punishment. Okay, now we're on transportation and travel safety. Does this look like your car? Lots of things here can happen. This one here, I'm going to say, let's just talk about autism for a second. You know, we can have somebody opening and closing the door handle or the locks up and down, the seat belts, taking it off, putting it on, you know, stimming on something. So lots of things can happen here. Really, really challenging. So, and this could also, this is personal vehicles, and I think in a little bit I talk about the school bus transportation, but these are issues. Driving on a road is, you know, we really need to be safe. So getting help from a behaviorist or from your medical care provider, your healthcare provider, or someone else, if this is really an issue, please do that. There is assistance that's available, whether that be a special car seat or a behavioral approach or whatever that might be. We really need to make sure when you go somewhere that you are safe and that other people who are around you are safe as well. Really quickly, I was on the road when I knew this person with autism on Route 22, Springfield, gets out of the car. On Route 22, car is coming in. My breath, I was like, I can't get out of the car. What are we doing? And it did wind up being safe, but these are the things that can happen. We really need to prevent them. So there's such thing, I'm not sure if you've ever heard of a certified child passenger safety technicians, and there's the link right there. It's done through Safe Kids and State Farm and NHTSA, the National Highway Traffic Safety Administration Association. Oh, I'll get that right. But they're CPSTs that are specifically trained for individual transportation of individuals with disabilities. And that could be medical, that could be like with their back or a trach or whatever they're transporting, or it could be for behavioral instances where that person is unbuckling the seatbelt and what are adaptive ways to get in and use the car. So make friends with that certified child passenger safety technician. These are the same people who get that car seat into the car really well. They have people who are specially trained with special needs. And if you click on that link and go to pick a technician, find a tech, you'll see the ones, there's actually a tab or a drop down for those who have that specialized training. I'm going to then say, don't be that person, because unless you're trained, we all come up with these adaptive ways to things to put on our car to make them more comfortable or to keep them from exiting the car. And we come up with these really creative mom and dad ways to do that. But these things are not regulated. And we do not, if you have an accident or you need to get out of the car quickly, this may prevent this. And they have not been tested by the manufacturer in your car. So there's lots of, you can get them on all different online. You can go and Google them and find these things, but I don't recommend them because they really have not been tested. Work with your healthcare provider, work with these CPSTs, and really make sure what you're doing really will protect your child in any way. I really want to emphasize, I love creativity, but not here. Okay, we do have what we call it social stories, what everybody kind of knows as social stories, but we call them pictorial narratives. We have developed some in all different topics. Here's one that we have online for wearing your seatbelt, or safety belt. So this is really helping the child understand when to put it on, how to put it on. You can see different colors here, because not all seatbelts look the same. We want to make sure they understand that whatever theirs look like in their car, they need to use it. So this is just one social story or pictorial narrative, personal narrative that we have. So now let's flip over from car to air. I'm going to go over this really quick. There is what's called a personal support specialist, or a TSA. That's the Transportation Security Administration. That's when we go in through the airport and we get to that security place where we have to give our passports and stuff. There are people who are trained or help support you if you have a disability. This is anyone, any person with disability, child, adult, anyone, they're there. Highlight this, call 72 hours in advance. Let them know ahead of time whether there's going to be medication, there's a wheelchair, there's a whatever it is, let them know so they're prepared. You will get to that airport. There's a card I'm going to show you. That little website there on the bottom will help you through this, but you let them know someone will be there to meet and greet you, help you through that airport, through TSA, you're good. And then once you get to the actual section where you wait for your plane, then it transfers from TSA to the airline. So I would call the airline too, because they're talk to the flight attendants, let them know what's going on. They'll help transfer if there's a wheelchair involved, but really make sure the TSA contacts you, let them know as soon as possible. There's that little card that you can print out and provide to them. And if you call 72 hours in advance, that's going to come up when they see your name at TSA. And if they don't, you could ask for a supervisor. They will not separate you from your child. They'll make sure you're together. And this will be an extra care during that whole process. Okay. And back to this for a second, just if they cannot deny you flight unless there's an impending risk when you go on that flight. So if they feel this child with autism is going to cause trouble on that flight to themselves, to other passengers, to the flight attendants or the flight itself, they can deny that flight, but they have to provide you as to why. You can ask for a supervisor. There have been really tragic instances where families have been on there and that child just wanted a special meal and they did not get that meal, and that they landed the plane and and they would not let them get back, and they were caught in another state and couldn't get back, right? So really, the more you can communicate, the more you can let them know what the needs are, the better it is for you if and when you want to play. We all want to fly, and right now it all changes with COVID, but really important to know. Okay, community safety, elopement and wandering, another pictorial little social storybook that we have developed here about walking through town, pedestrian safety. That's some more work that we're doing. With our grant, we're doing more on that. We have available to print, and you can even make one yourself, depending on, this one's for autism, but you can kind of go on there and make. You can use those business cards you can buy in the printer store, and instead of using those business cards, make IDs, right? And you can tear them apart, laminate them, do whatever you want. But it's important to have them, and I will tell you about a story in 1 second, but the decision to use them, whether you're an adolescent and adult, is always your choice, right? You do not have to disclose your disability, even though I will make that recommendation that it is better to provide that information to prevent something from going bad than to not. So I'm an advocate for the use of ID cards, but it is a personal choice and you do not have to disclose a disability. I'm going to use autism for a second. It could be any disability, but let's just say this person is an adolescent. He didn't have very good personal hygiene. He's wearing a hoodie. He's not walking really well. Could be any disability. And this officer is thinking, this person might be intoxicated, might be on drugs, whatever it is. And hey, where are you going? And this person was taught to get his ID with a police officer. So he now goes into inside his, forget it's in a pocket. Let's just say he's going in where he has his ID. And now what does that officer think he's going for? We're going for a weapon, right? And so this is an emergent situation right now. It's a fight or flight for the police officer. So we need to teach to the ID. May I get my ID out of my pocket? Or my son has one on a retractable keychain that is outside of his clothing, right? So we really need to pay attention to, yes, providing these IDs, but how we present them and what we say, if we're able to say. If a person has a communication device, that's really great because you can press my name is or I live, so you can use those communication devices for that. So there's where I say how it's presented. We can have the IDs any way we possible. It could be on, on a wrist, on an ankle, and wherever we wear it, but pay attention to how we present it because we don't want that to be misinterpreted. These you'll see, we see blind child, deaf child, and we do see these autistic child. So whatever sign you use, I really want to emphasize, if you have the right to do it, and if after this presentation, if you'd like some information how to get that in your town, I can give you some tips. But I want to emphasize that this sign in front of your house, it's actually not actually inside of your house. It's on two sides of the road, a little bit past your home on both sides of the street. But it just having that sign does not mean that the drivers understand what it means. What does autistic child mean? What does it mean to safety? What does it have to do with my driving? So I don't want to give you the false impression that that sign is going to help with traffic and pedestrian safety there. It may help. I've communicated this via a letter to the editor. I sent, when my sign went up, I did that letter to the editor, and I explained to the community why I was doing that. Talk to your local municipality, let them know what's going on, have the conversation with your law enforcement, police, fire, rescue, right? And talk about that, because a sign just isn't enough. This parking, accessible parking, can my child with a developmental intellectual disability with autism, can we get that for them? And the answer is probably yes. It depends on the child. I'm not going to say for sure. So it really has to do with physical, whether the person can walk safely from the parking lot to where parking space to the entrance of where they're going. It could be heart conditions, physical conditions. It can be multiple things. But if it is unsafe for your child or the person to go that distance, this kind of accessible parking is likely available. So it needs a prescription from the doctor. There's a whole process, and those links to apply are right there at the bottom of this slide. So don't assume it can be done, but I will tell you that the New Jersey Motor Vehicle Commission is aware of the safety dangers related to autism and other things. So it is in consideration, but again, it needs to be a safety issue, and it does need to be accompanied by information from the child's physician. As our kids get up in age, and we're talking about adolescents to adults, remember the transition plan in school? Let's teach them some things that they may need when they go into our real world, right? ATM safety, what to do. And we, again, are providing, I say again, but we are making resources to help with the safety here, but also things like refilling a prescription, using Uber or Lyft or one of those other transportation things. So don't think all safety, quick fire safety and home safety. Let's really empower those individuals who want and need to live a full and meaningful life. Real safety tips, things that we often learn as a matter of course, but sometimes we need to teach them to kids with disabilities, adolescents, adults, so that they are safe too. We want to make sure everyone is safe together. Elopement and wandering, significant issue for kids with autism, adults with Alzheimer's, people with dementia issues, some people who are experience suicidal thoughts and want to elope and get away. So these are really some significant things that we really need to pay attention to. So many organizations, the government, everywhere, all over this country are really focused on this issue because it's so significant. So recommendations are here. Securing windows, doors, using alarms, visual signs. I'm not going to go through each one of these for time, but there are many ways you can do this. There are organizations that can help you. You want to talk to your healthcare providers. So many things are available to you, but please, please talk to someone. Don't assume they won't. When we talk to the statewide, actually the nation, one of the nation's leading subject matter experts on this topic, it's about acting quick. If your child or adolescent adult is out and they have a special healthcare need, autism or other, it is imperative to act quick and contact the people that you need to and communicate as much as you can to them. Critical, the time is of the essence. That's the biggest emphasis that I have on that. Personal tracking devices, we hear of those. We all have them for our cars or on our phones, but there are some that are available for individuals with autism, Alzheimer's, all people that have the tendency to wander. They range in price. They have annual charges and contracts and all these things that are going on, and not everybody can afford that, right? And so there's also different types of technology. Some are GPS, some are cellular, some are radio signals. So people ask me, what's the best one? And there really isn't, because it depends on where you live, what your child's challenges are, all of these things. Will they keep the device on them? Will they not? How secure is it on them when they wear that? So there's lots of them here. They can be in the pocket, on the wrist, on the lanyard, all different ways to wear them. So lots to consider. Everything is individualized. We created this resource here that kind of gives some general guidelines to buying them or evaluating them, I should say. We have some of the popular ones there on the right, but you'll hear Project Lifesaver is one that is very often recommended. It is endorsed by every county in our state, but there's pros and cons to all of them. So I'm not going to recommend one or the other, but please realize that there's a lot to consider when evaluating a personal tracking device, and to go to your local organizations, your local municipality, your law enforcement, the sheriff's department is for Project Lifesaver, to tell them what your needs are, and hopefully someone would be able to help you. There is a medical diagnosis, Z9 1.83. So what's that for, right? But that's your doctor could actually give that diagnosis that your child with autism has this tendency to wander. So they're going to have the diagnosis of autism and the tendency to wander. And then perhaps you might be able to submit this to your insurance. You can try, in my experience, I don't know of one insurance company that has then covered that, but that denial is also very important, because with that denial, you can then try either to perform care or to your local a fire department or wherever, and saying, hey, we really need this for safety. The insurance company denied this. How else can I get funded, right? So the process is important. You can try, you may be covered, and that would really be great. I noted here that it's really would be helpful, just like we have a safety plan for fire, let's have a family wandering emergency plan as well. And you can talk to your child's pediatrician, a healthcare provider, other therapists, emergency responders to help make that plan. Here, I said I briefed here just quickly about Project Lifesaver. There are pros and cons, but this is pretty much available in every New Jersey county through the Sheriff's Department. Drowning is the leading cause of injury-related death for people with autism. Many people, particularly with wandering and elopement, will be attracted, know how to swim. They may not understand the water temperature, how deep the water is, the danger that's involved, from falling or jumping. So really important to know, particularly if your child loves water, but I cannot emphasize enough to teach your child to swim, and or depending on their child's capacity and understanding, water safety education. I know Children's Specialized Hospital offers that. Many organizations throughout New Jersey do offer water safety education and safety prevention, preventive measures for safety in and around the water. Again, to build those relationships with local emergency responders and let them know your concerns about water safety. Teach your children about water and be safe, and always protect water sources around you. All right, emergency preparedness. Emergencies can happen anywhere, anytime. We don't know. It could be the lightning that just I thought hit near my house just the other day, or it could be, like I said, a fire. It could be, we're talking about COVID here, we could mass disaster, it could be anything, and we don't necessarily expect emergencies. So everyone, all of us, whether we have a person with a disability or not, we all need to be as prepared as possible and prepare that any kind of plan before the emergency happens. So here again, I recommend to contact or discuss with your local emergency responders some of your needs that you have. Local fire department to help with, if your child does not respond to the smoke alarm or fire alarm, then what are some alternates to help them do that? If your child's bedroom is on the second floor and they have a physical disability, what do we do? If you live in an apartment, what do you do? So let's prepare and plan before an emergency happens. This is on a resource, queue there. It's a safety plan. So it's really, again, describing what to do, talking to family and friends, getting your supports in place before the emergency happens. So this, we always kind of say tomorrow's another day, but really we don't know when it's going to happen. And I really can highly recommend one day, make it a fun day, let's do a safety plan together and figure this out. And actually it could be fun in the planning, but it's also probably an aha moment that is probably more comprehensive than you ever thought it was, because we're talking about maybe medicines and medical information, medical supplies, wheelchairs. If you have a motorized wheelchair, that battery, and what if that battery dies and there's no power? Like, there's just so many things. My son, he is not toilet trained, and we have diapers and he soils through clothes, and we talk about then if the power went out, I have nowhere way to wash all of this very horribly smelling infested stuff. And then what about the sanitary aspect of that? Or he has a communication device or other ways that he keeps himself occupied. How is that getting charged? So for a typical person, hey, I don't have my TV, but when we're talking to somebody who this is their routine and this is all they know, these can be very significant things. So how are we preparing and charging things and getting things ready for the emergency? And here, like I said, the devices, the medicines, the communication devices, all of those things I just mentioned. Register ready. I'm going to be the big cheer flag. I recommend everyone here register ready. There's the phone number. There's the website. It's free. It's voluntary. It is where you can provide all this information to a confidential group, Register Ready, part of the NewJersey.gov. It is totally confidential, and it's only used for emergencies. But this is where you say, I have medicine that needs refrigeration. We have a trach. We have a wheelchair that needs batteries. I need assistance getting dressed. My child cannot eat on his own. All of these things, language barriers, it could be anything, would go into this. We have to update it. You have to review and update it each year. But when there was Superstorm Sandy, for those who went through that, or any other disaster, this is where your local regional group looks and says, what do we need here? We need ramps for wheelchairs. We need refrigeration devices. We need a quiet space for this, this group of people who have autism. Really, I cannot emphasize enough. This is really one of the best things you can do before an emergency to get onto this list. Here's some more. You can refer back to this, but here are some other emergency preparedness websites that may provide you with some additional information. All right, police interactions, law enforcement, and criminal justice. So this can happen anywhere. I think, just when we're pulled over in a car, but when we access government buildings, when we go to the airport, at community events, when we go to a concert and have to give up that bag and they have to inspect that, right? Think about a child with autism who really loves this favorite bear or this bag, and now have to give that up, and what might happen there. So let's prepare for that, right? These are things, and how do we interact? How do we plan for and practice a lot of these types of security checkpoints that might happen with our kids? And these are just some things I listed here that they could be misinterpreted, right? Or maybe challenging. So waiting in lines can be hard for some people. Those questionings that are asked, how do they respond to that? And they may ask, have you ever been here? Yes. Will you, and they can ask questions. Yes, yes, yes. And so they may be saying yes to the wrong question, right? So these are things that we really should prepare for and help practice, whether that be at home and or at school through the IEP and through some safety goals that you implement within those safety plans. Here in New Jersey, we have something called a criminal justice advocacy program. These are for people with disabilities who it's to prevent, obviously, things that from them getting involved in criminal justice issues, or this could be if they have somehow gotten into a situation, but maybe they didn't understand what they did, right? So this is something they've done, but they did not even know they were doing wrong. They may have gone from one theater to another and not paid to go from one movie to another. It could be anything, right? So this wonderful program here, it really provides a lot of helpful information, advocacy, support. The website is there at the bottom of that page. And school safety. We talk about safety drills. So we all know those fire drills we talked about. Now there's, the lockdown drills, all these different alarms and drills that happen in the school, but now put that into perspective of our children with various special healthcare needs. So kids with anxiety, who may now act differently in during a drill, a person with autism who now you're asked in a lockdown drill to stay in a place that's dark and quiet, and how do we do that? So these are all important things that you need to consider and have that conversation with your school. The school should have, and they don't necessarily have to disclose what that plan is, but they should have a safety plan that's inclusive of students with special needs, right? That should be part of their program. Do they have to explain that detail to you? No. But what you should do is talk about your IEP and what is specifically for your child. If he's on the second floor and you're in a wheelchair, what are you doing? If he's in a lockdown drill, what are we doing? You can have those discussions, particularly related to your child's IEP and how they can support your child to be safer in these, because we can't forget that we said, okay, well, we've got this, right? But how do you have that, right? And you have the right to be able to put that in place, that they're securely and safely being handled during emergency situations. Training, school bus transportation, there is a law in New Jersey that requires bus drivers and aides to be trained. You can find that training online. You can see it. It's there and available. I gave you that link below there. Really very helpful. But they are required. But they may not know anything about your child in particular. So I gave you, these are just all the different types of the information and the training that's available for them, just so that you're aware of what they are. But there's also this sheet that you can print from that page, which gives you have the right to provide that bus driver and aid with whatever information you think they need to know. So, my son actually, back when he was on the bus, this kid loved to take his lunchbox and he would climb over seats just to grab that lunchbox. And so what were they doing there on the bus? And one day they hit it and that kid climbed to the driver. And now tell me how that didn't affect the safety of those kids. So these are conversations, important conversations to have. You can talk to your transportation at the school, that your transportation group that arranges for the transportation, as well to the school bus driver and aide themselves. And treat them nicely. We always treat them nicely. So these are some tips for improving the student school bus experience. And all the links are there below. These are areas of consideration that you can put within your IEP. So does your child need an attendant or aide? Is there a certain bus schedule? What about field trips? Are they, a special bus for those field trips? Does your child have seizures or allergies, and how are they handling that at the bus during that bus ride? Do they need a particular nurse on that ride with them? All of those types of things could be discussed and implemented as part of the IEP. And if it's not part of the IEP, it doesn't have to happen. So put it in an IEP. It's a legal contract, and make sure if it's something significant to the safety of your child, put it in. If they don't, I don't know what the issue might be. If they don't, there is a section of the IEP for parental, I don't know what it's called, just for parental comments or whatever. You can ask, say, I would like to put this into the parental concern area, and then you put that in there so it's clearly still in the IEP. And lastly, some safety education tips, right? So how do we teach safety, right? And we want to make sure it's taught in an understandable way that's clear and simple enough. Very often we hear from our older disability advocates that it was always taught to the aide or to the teacher or to the parent, but never directly to them. We want to empower our kids as best they can to be as safe and increase that as they, become independent adults. So let's teach directly to them. Let's teach them in very appropriate ways. Find out what the barriers, what is a communication, what is it the way, do they need to use pictures to understand, or is it words? Is it best if we practice? So there's just different ways that we can teach safety. So here are some ways that we can teach safety education. Really, we can teach anything, but important to adopt this based on your child's needs and learning style. And some for the IEP, here are just some things that I think are some core safety things for, I mean, obviously they can get, like I said, using the ATM and all that, we can get very much deeper into fire safety skills and pedestrian skills, bike skills, all of those things. But here's some core safety skills that I think we want to make sure our kids understand and know. And ta-da, how much time do we have? Did I do it? We have like 10 minutes.
Wow, is all I can say, Adrienne. Let me tell you something. I am so grateful for how organized and how thorough you have been with putting this information together. Not only the presentation that you've just given, but I know there's a lot of links and printable things and resources to go to. I really can't thank you enough for how comprehensive, like when we talked safety, I don't think I went through all of the different areas so thoroughly. So I really hats off to you.
Thank you. And it's personal, right? So as much as I presented, this is different for every single person that's on this call and every child, right? Or adolescent, adult. So you need to take this and personalize it to make sure it's what reflects you, and talk to your healthcare providers, talk to your emergency responders. Really, it's very much individualized for every person.
You know what? It is individualized, but I want to underscore in case and not everybody's hearing it, but I'm sure they were. I mean, you just have a very reoccurring theme of number one, plan ahead, right? Just plan ahead, empower yourself, empower your youth, and think ahead as much as you can. And also just communication seems so key. And that I love the suggestions of reaching out to the emergency responders as far as helping them understand what's going on in your home and with your youth, and also helping the youth understand what might happen when someone shows up in a uniform, or when they need help, who to go to. I mean, you just can't say enough about the importance of that, laying the groundwork, right? And I know you can't guarantee that behaviors doing A will result in B, C, and D, but you have nothing to lose in trying, right? And hopefully, like you said, when the team knows, I really value that point that you said over and over again, even in the emergency plan, leaving a house because of fire, right? Like, I think even who's your team, like you said, when you've got an eloper, your neighbors. It helps if your neighbors know if they see something that looks like it might be of concern, that they know you're okay with them calling you and saying, oh, I just saw Josh going down the street. Are you aware? Right? I mean,
and many, I don't know the details of the law enforcement. Every community is different and depends, rural, urban, it depends on where you live, but many police or emergency dispatch systems have a, so let's just say my mother was on oxygen. I could communicate to them, and that would be on the system in my local municipality. So if they would know if there was an emergency, or if the power went out, they know they have to get to that person, because they're relying on that oxygen, right? So the same thing can go through with wandering, elopement, whatever. There is many times a database that's within your local emergency responders that holds some of this information, the critical information that can help them in emergent situations. So communicate with them. They're really, they would want to know. They want to protect and to serve.
And I think we know too that, as you were saying, every municipality is different. We've got, especially in New Jersey, there's such a range of whether it's urban, suburban, rural, whatever it might be. But in my experience, we've been involved with some webinars with helping law enforcement communicate with families and youth, just about miscommunications, right? About one side not understanding what the other is dealing with, and vice versa. And I just think there's so much to be gained by asking a question, starting a conversation, and really just trying to connect and communicate. So I heard that loud and clear on a couple of different topics. And like I said, I think it's really so valuable. And I'm going to remind everyone that we are recording this, we are going to be sharing this, and as well as the slides, because Adrienne, you did a fabulous job of covering a lot of topics, giving a great overview, but there's so much more information on each slide. If there's a topic, if there's something that you want to follow up on, I urge you to go back to the slide when you receive it. And we will make sure that we have websites and links that Adrienne embedded, so that all you'll need to do is click to follow up and or print something. And I don't see any questions in the chat. I'm going to ask one more time. If anybody has a question, please feel free to offer it up. But Adrienne, I will be sharing your contact information.
Please do. I was just going to say that. Please do, because many people have asked me, you know, all right, you talked about this, but now, what about this or whatever? If I don't know, again, I don't know your personal, the diagnosis or what the personal environment might look like or the challenges, but I can at least point you in the right direction or give you the recommendations that could at least help you in whatever way. So they call me Resource Central. I'm kind of the safety girl over at Children's. So feel free to give me a call. At least I can help connect you or hopefully provide you with whatever information or resources you need.
Well, thank you, Resource Girl. We're very happy to have you with us today. And I am just going to say that I also appreciate, with the challenged youth, that's who we focus on, but a lot of this information is also helpful, as you said, if there's an elderly dementia patient, whatever it might be. A lot of these tips are very applicable to other areas. So Adrienne, thank you for taking time with us today, but for also putting together this information that we will be sharing. I love to share, and I know we have a lot of families that will be checking you out later on our YouTube. So thank you for being with us. Adrienne Robertiello, who is with the Children's Specialized Hospital. Thank you so much. And Coles Cares, I'm going to give a shout out to them. Let me tell you something. What wonderful things that fundraising that they are doing is presenting. It's very needed. And I think, I'm a glasses half full kind of girl. We hear a lot of obviously things that we're concerned about going on in our media and in our world, but to hear that an organization like Coles is supporting something as important as this education and planning and strategy and cooperation. I mean, we all know it takes a village, but I really think this is an example of what needs to happen more in our world. So thank you to Coles, and thank you to you, and everybody. We hope to see you next week.
Have a good one, everybody. Stay safe.
Healthy.
Bye-bye.